Melanie Helmke from Milwaukee Area Technical College's Dental Hygiene Program. We will continue with Part 2, Dental Radiographic Pathology. We will also be seeing restorations of the teeth on these radiographs. The arrow for number 30 points to a pulp stone. Little problem is attached to these pulp stones unless there's going to be endodontic therapy. Above we see tooth letter A. This primary tooth has mesial interproximal caries. Would the dentist place a restoration on tooth letter A for the mesial interproximal caries? The arrow pointing to tooth 29 shows a wider, fatter root surface, hypercementosis, due to additional cementum on the root. Tooth number 29, as the arrow points to, has a dilacerated or crooked root. Tooth number 30's distal root also appears crooked or dilacerated. Is this arrow pointing to a retained root tip? The slide says a supernumerary tooth. How do you know this is a supernumerary tooth and not a retained root tip? Above tooth number 3, we see a radiopacity, the zygomatic process. The arrow points to fractures in the root. The wires that you see are Teflon wires holding the root in place while healing occurs. Eventually this tooth will need to be extracted. At the apex of this tooth, number 25, we see the bullseye, or we are looking directly at the apex of the root. It's radiolucent. Lower on this slide, we see two other radiographic anatomy structures, one radiopaque, one radiolucent. What are they? The significance of tooth 26 is not the fracture but the severe caries. We see root caries on the mesial of tooth number 27. On the distal of 25, there is an opacity on the root. What is this? On the mesial of tooth number 25, we see severe bone loss by the radiolucency along the mesial root. Here we see a tooth socket where a tooth has been avulsed or knocked out. It has resulted in splintered bone. The periodontal lamina dura has been splintered. Splintered bone is also known as bony sequestra. Here the arrow points to amalgam in an extraction site. Perhaps the tooth had a lot of amalgam and some fractured when it was being extracted. Clinically, when we look in the mouth, this shows as amalgam tattoo, usually a bluish-gray appearance on the tissue. These arrows point to gold. We know it is precious metal because it has been cast and has a smooth outline. At the cervical area of tooth number 31, we see some stainless steel pins that were used to retain amalgam prior to crowning this tooth. K and L have stainless steel crowns. The dentist purchases these crowns. They are not cast. They have a varying opacity because the density is less for stainless steel than for precious metal, gold. I and J above these teeth have proximal caries, the distal of I and the mesial of J. J also has a large occlusal area of caries and an incipient area on the distal at the contact. Tooth number 31 has a space maintainer. Notice how it has continued to drift forward because of the caries on the distal of 29. The space maintainer, stainless steel, has varying opacities. There are incipient caries on the distal of tooth 28 and the mesial of tooth 29. This arrow points to a radiolucent anterior tooth-colored restoration. We know it's a restoration due to the cavity prep. Notice how on the mesial the restoration is very dark, and that is because the entire tooth, facial to lingual, is restored. The mesial cervical of this tooth has recurrent caries, as well as the distal cervical of tooth number 8. The arrow points to a porcelain crown that covers the entire crown of the tooth. However, porcelain is radiolucent. Therefore, we see the peg or outline of the tooth prep. The cloudiness of this outline, or the opacity over it, is the cement in the crown. Porcelain is radiolucent and therefore appears that it only covers the outer areas of the tooth, when in fact it covers the entire crown. The arrow points to acrylic, a radiolucent tooth-colored filling material. Acrylic is used in making dentures. There were problems with the acrylic staining and with leakage around the margins of the restoration due to changes in temperature. Notice that there's an opacity near the apices of these teeth. This represents the outline of the nose. The lower arrow points to composite, a radio-opaque filled resin used as an anterior filling material because it is tooth-colored. The arrow above this points to a silver point root canal. Silver points are not used anymore for root canals, but you may see them in your patient's radiographs. Here the arrows point to zinc oxide and eugenol, or in general cement. Cement is less opaque than amalgam, as the arrow to the right shows, but more opaque than enamel and more opaque than composite. Composite and enamel have similar opacities. Zinc oxide and eugenol, or cements in general, are more opaque, and amalgam is the most opaque. Gutta percha is a radio-opaque filling material that's used for root canal fillings. It comes from the latex tree. People with latex allergies, though, do not have difficulty with gutta percha in the root canal, as it is sealed with a restoration. Gutta percha is a very old material that has been around probably for over 100 years.